All right, welcome back to Biology 1218, our next online lecture. We're going to finish up the urinary system today and look forward to talking about acid-base balance and water and electrolyte balance using the urinary system. So we'll go ahead and continue on from where we left off just a little bit ago. And I want to talk a little bit about, we're talking about the structure of the urinary bladder. And let me go back to this diagram here in the textbook. This is on page 981, everybody. And I want to point out a couple of things. Obviously, got a female bladder and urethra here. Notice the urethra is much shorter on the male side, the bladder, and a much longer urethra. Okay. Now, having just mentioned the external and internal urethral sphincters, the internal urethral sphincter, again, a smooth muscle, that's at the base, right at the bottom of the urinary bladder, both here and here. That's the female side. And then you have an external urethral sphincter that's made up of skeletal muscle that encompasses also the urethra, right here near the bulbourethral glands in the male, and right here near the urogenital diaphragm in the female. But now, the last structure in dealing with the urinary system that urine will pass through is the urethra. And obviously here, if you compare the male urethra, which is much longer than the female urethra, that equates then oftentimes to that women have more urinary tract infections than men due to that shorter urethra. That's a big part of why that's more common in women. But let's go back to the urethra here, and I'll finish up with that part of it, the urethra. And this is a structure that transports urine from the urinary bladder to the outside of the body. And within the urethra, due to the fact that the male urethra is longer, there is a lower incidence of UTIs in males compared to females. Now, UTI, that stands for urinary tract infection. Let's write that out here. A UTI that is equivalent to urinary tract infection. And that's most commonly when some type of bacterium is able to migrate up into the urethra and then into the urinary bladder and then resides there and causes some pain sometimes, frequent urination, painful urination, things like that. That can be treated, of course, with antibiotics, but it's more common in men than it is in women due to the shortness of the female urethra. Now, lastly here, I want to talk about the process of micturition. Micturition is the process of urinating and how that process goes about in voiding urine from our urinary bladders and then out through the urethra. Now, what happens normally is this. The urinary bladder, as you know, you're watching this, the urinary bladder in your body is filling. As urine flows down through the ureters into the bladder is going to start to expand. It's going to put pressure. And what happens with that is there are then stretch receptors in the wall of the urinary bladder. And as it stretches more and more, as it fills more and more, it will send out an action potential. And it will send out an impulse that will go to the brain. And you will sense that, you know what, it's getting closer to the time that you have to go to the bathroom. Now, what will happen with that is this. There will be an increase, a couple things I want to mention. There will be an increase in parasympathetic activity. And what I mean by that, remember the sympathetic and parasympathetic branches of the autonomic nervous system, those control smooth muscle. And as this happens, what will happen is the detrusor muscle, which is the major muscle in the urinary bladder, the detrusor muscle contracts. And also, the internal urethral sphincter opens. Okay, so we're putting pressure on the bladder, we're opening up that internal urethral sphincter. And the other thing that will happen with this, coming from the brain, which is the one we have control over, is that and this again when we're having to go to the bathroom, the external urethral sphincter will open and out will flow the urine, and you will go to the bathroom. Now, when it goes to the external urethral sphincter, that is through a somatic motor neuron. Remember, that is not, since the external urethral sphincter is skeletal muscle, that is a voluntary type muscle, so that's voluntary activity, okay? All right? So that's the process of going to the bathroom. Again, that's called micturition. We normally call it urinating or voiding, but that's more of the technical term for it. Now, I do want to mention a couple of things with that, and mention incontinence. Incontinence, and going back here, let me just make sure I've got this. Incontinence. And the term incontinence, what that deals with is inability to control micturition. In other words, a person cannot control when they go to the bathroom. And normally with this, again, toddlers obviously don't have this control, or excuse me, newborns don't have this control. They develop that, you know, somewhere around about 24 months, 2 years of age. But what also happens is that sometimes this will affect older people because it atrophies, and they can't control it as they get older. Now, the other thing I want to mention too is this, that as we age, aging and kidney function, as we age, there's usually a general reduction, a decrease in kidney function. There's a loss of some of the nephrons, and our kidneys will start to atrophy as we get up into our 70s, 80s, and 90s. And another thing that happens with that is that usually there's less filtration, and the bladder, the urinary bladder, oops, let's put here, the urinary bladder, shrinks with age, with aging, with increasing age. And so what happens with this, there's usually oftentimes what happens is people have to get up and go to the bathroom. And there's a term for that, is getting up at night to urinate, and that's called nocturia. And that term is in reference to getting up at night to urinate. And this affects a large percentage of the population. You know, close to about 65–70% of the population in the U.S. Suffers with this. And again, it's just something that we have to deal with. And what happens with that is the bladder shrinks, loses some of its tone, so it's not as expansive as what it was when we were younger. And that's what happens with the urinary system there as we age. But again, most of us have good urinary function up into our 80s. It's just that we have some of these issues where we have to get up to go to the bathroom at night, maybe have to more frequently urinate, and so forth. Now, a couple other things I just want to mention. With the lecture today, I want to go to dealing with fluid, electrolyte, and acid-base balance. So we're going to shift gears here. Now we've got kind of a basis as far as how the urinary system is set up anatomically and physiologically, and I want to then turn that into how do we use the system, how does the system regulate us? And it's just incredibly complex mechanisms by which our urinary system maintains our water balance, our electrolyte balance, how much sodium, potassium we have in our blood, how much calcium we have in our blood, and also helps to maintain that blood pH. So I want to shift gears here, and let's take a look at chapter 26. It's 26. And we're going to deal primarily today with fluid balance, and then we will also deal with electrolyte balance and pH balance, acid base. How do we maintain those things within our bodies? Now, I want to start out, and we're going to take a look today to start with today at fluid balance. And the first thing I want to just mention is I want to talk about fluid compartments. Fluid compartments in the body. And the fluid compartments that we have. And normally within your body, think about this for just a minute, about 60% on average of an adult is made up of water. So 60% of your body weight equals water. Okay? So if you weigh, let's say, 200 pounds, we're talking about 120 pounds of you is water. Now, where you find that is this, and let me just, on average, when you take that 60%, a lot of that is found in what's referred to as the intracellular fluid. Now, Josh, do you know what intra here in the studio? What intra means? That prefix INTRA. Not quite. It means within. So like intramurals are sports that are played within students of RCTC, and you might play another team of RCTC students. And this is fluid that is found within the cell. So this would be the equivalent of cytoplasm. The cytoplasm in the cell. So this is actually the molecules within the cells. And that makes up roughly about 40% of your body weight is that fluid within the cells in the cytoplasm. So again, remember you take a cell, it's been a while since we've drawn a cell. Here you've got the membrane, all right, kind of a cuboidal cell here. Here in the middle you've got the nucleus. And the nucleus. And then this area here in white right there, that's going to be the cytoplasm and the organelles. But the cytoplasm is where this component is, the cytoplasm, which is the water fraction that's in there. Now, that makes up about 40% of the body weight. And then you have, if you have intracellular, then you have extracellular fluid. And the extracellular fluid is the fluid outside the cell. And so that's what we refer to as extracellular. And what happens with this, as far as what the extracellular fluid is, this is made up of two parts. The interstitial fluid, which is the fluid between the cells, not within, but between the cells, all right? And it also consists of the plasma. And plasma, if you remember, that's the liquid part of the blood. That also has within it glucose and sodium and potassium and different electrolytes and things like that. So this is what makes up the extracellular fluid, the interstitial fluid and the plasma, okay? Now, within those fluid compartments, okay, and I should mention this too, as far as when we talk about percentage of body water, okay, that's going to vary a little bit between the sexes, and let me just explain why, okay? And not that this is always the case, but on average, let me get this paper straightened out here, okay? An average male, an average female. And let me ask Josh this question. Do you know which sex, Josh, has more body, their weight is made up of water? Which one do you think has a greater percentage that's water-based, men or women? Okay, it's actually men. Water by weight. And females, it's about 50% water by weight. Now, the reason is that on average, women tend to have relatively higher levels of body fat than males, and less skeletal muscle. Now, again, this is on average. I'm not saying this is the case with every woman by any means. But what happens with this is women tend to have more fat and less muscle, and so they have less water. And men tend to have less fat and more muscle, and that means more water. Okay. Now, those are the compartments of the body fluids. Okay. And I want to just mention before I get into where water moves and how it moves, I should mention a little bit about the electrolytes. Okay. And talk about the electrolytes that we've got in the body. And let me just do this. Let's talk electrolytes. And electrolytes are chemical compounds, are compounds that dissociate in water into ions. Now, an ion is an atom with a charge. So, Josh, let me ask you this. What are some of the electrolytes that you eat? Okay, potassium. Anything else? Sodium, chloride, calcium. Those are four common ones that we get. Now, sodium and potassium, these come from the salt that we eat, the table salt. Because table salt is NaCl, and when you put salt, NaCl, into water, right, it will dissociate into sodium ions and chloride ions. Okay. Potassium, you find this in bananas. And Josh, where do you find calcium in your diet? Dairy products, exactly. So milk, cheese, ice cream, okay, those kind of things. All right. Now, keep in mind that electrolytes are found in the body fluids, in our fluids in our body. Now, what happens is that we have exchanges of fluids and electrolytes across cell membranes. And I want to talk a little bit about movement of the electrolytes and of the fluids in our body. And remember that when we talk about a solution, I just got to go back and I got to define this term, okay, the term solution. And Josh, do you remember back from your chemistry background, do you remember what a solution consists of? What are the two components that make up a solution? Okay, so it could be the solvent, and the solvent in our case is going to be water. Now, it could be something else if you're making up a chemical solution. But in our case, since we're dealing with the body, it's going to be water. But you know what? The solvent plus what equals the solution? The solute. And solute is usually the dissolved substances And in our case, that's going to be, as we go through this, primarily it's going to be the electrolytes as we go through this, okay? But a solvent plus a solute equals the solution, all right? Okay. Now, I want to start out and just mention a little bit about water balance, okay? Got to talk a little bit about water balance. And you can also think about this as water homeostasis, okay? Now, let me do this. Do you know, Josh, let me ask you this question. On average, how much water do you take in a day? Do you have any idea how much water do you output? So let me back up. For water balance, the water intake has to equal the water output. And Josh, do you have any idea how much that is on a daily basis? Do you know? Okay. Usually that's around about 2.5 liters. Okay, about 2.5 quarts. Now, of course, that depends on, too, if you're sweating a lot, if you're going to work out, things like that. But let me ask you this. Most of the water that we take in every day, or water intake, where does the water intake come from? Do you know, Josh? Okay. So roughly, I'm just going to write down here, about 1.5 liters comes from the different beverages we drink. That would include orange juice, milk, tea, coffee, wine, whatever it is somebody's consuming. The beverages oftentimes about 1.5 liters. And then our food actually gives us about 750 mils from the food. So when I say food, the apples, the bananas, the ham, the black beans, the carrots, the lettuce, all those things have water within them. And then roughly about 250 mils of the water that we come in, that we get as far as an intake is from metabolic water. And where this comes from, this metabolic water, which I write down here as metabolism, comes from this process. Do you remember at the end of the electron transport system, electron transport chain, 2 hydrogen ions plus 2 electrons plus a half of an oxygen combine to form H2O, okay? And that's metabolic water. That comes from ATP synthesis. And since we're doing ATP synthesis on a daily basis, you actually make a small quantity of water, about 1/4 of a liter, 250 mils per day. And what happens is you retain that if you need it. That's what's referred to as metabolic water. Now, Josh, do you know as far as output goes, how do you go about losing most of your water on a daily basis? Exactly, voiding. So roughly, on average, and if you remember this, those of you in the last week, remember about 1.5 liters of urine is fairly common or normal, okay? And that will be measured if you have a patient who's got a catheter bag, catheterized and has a bag there. We'll measure that before we empty that, and we'll chart that in their records to make sure that their kidneys are functioning properly. Josh, how else do you lose water on a daily basis? You know, sweating, okay? And so you'll have roughly about 700 mils. You don't have to memorize all these numbers here, but about 700 mils are lost from your skin and your lungs. So as you cool yourself, okay? But skin and lungs, another 200 mils from sweat. Now, when I say skin, I'm saying like just coming through your skin normally as you're sitting there, because you will lose water through the surface of your skin. Another 200 mils, and this could be, again, this is just, could be through sweat, and then roughly about 100 mils per day through feces. Okay, there's a small amount of water in fecal matter, and obviously that increases if one has diarrhea. Okay, but we've got to balance our water. Now, I don't measure the amount of water I drink every day. I don't measure how much sweat I sweat or anything like that. But our body, through the nervous system and through the kidneys, is able to maintain my water balance. So whether I lose 3 liters of water or 2 liters of water on a daily basis, I can replace it with 2 liters if I lose 2, replace it with 3 if I lose 3. And the body is just designed to be able to maintain that water balance. If we don't maintain water balance, we can end up with some major problems with thermoregulation. How are we going to maintain our body temperature if we're losing too much water? And that can end up actually in death with hyperthermia. We need to maintain that body water, that water balance. So how we regulate water intake, okay? And that's the next thing I want to take a look at. And let me move this down here. There we go. The regulation of water balance. How do we regulate this? It's kind of an interesting regulatory act. And there's a couple of things that we do. And let me just do this to start with. If you have, and let's start with it this way. If you have some dehydration that's setting in, and that could be due to sweating profusely, or a lot of diarrhea, blood loss, a variety of things that can cause us to dehydrate, but sweating is primarily the major mode by which this operates. But when you have this happen, what happens is you'll get an increased level of osmolarity in the extracellular fluid, the ECF, okay? That's an interstitial fluid in the plasma of the blood, okay? And think of osmolarity. Remember, osmolarity deals with the concentration. It's a concentration term that we use in chemistry. And so how many particles are dissolved in a unit of water? And if you have an increased osmolarity, think of that as you have more concentrated, a concentrated solution. If you increase the osmolarity, the solution is more concentrated. Now, what happens is this, is that would affect not only my blood, it would affect some of the interstitial fluid. And in this case, what happens is there's kind of a multi-step process here. But there are up in the brain osmoreceptors that exist in the hypothalamus of the brain. Remember, the hypothalamus is just directly below the thalamus. Now, osmoreceptors, what they do, they sense changes in water loss, okay, either gaining or losing water. So they sense changes in osmolarity. Now, once they are activated in the sense that there's more concentration, that will activate the thirst center in the hypothalamus. Okay, and when you do that, what should happen then, Josh? Do you know? When you activate the thirst center, normally, if you have it available, a person drinks some water, whether that's in a Gatorade, Powerade, bottled water, whatever it might be. But a person takes a drink of water, and what will happen then is that will, when you drink water, that will decrease the ECF osmolarity. You will dilute the blood, and you will increase your plasma volume. And what happens then is that will then reduce your thirst. Okay. And when you get thirsty, most of us don't spend 2 hours at a drinking fountain just lapping up water and drinking. You usually get to a point when you're drinking water that eventually you stop. And that point at which you stop is variable depending on how much water you've lost. If it's an 85-degree day and it's bright and sunny and hot and humid and you're playing tennis and you don't have much water, you may get to a point where you stop and then you get access to water. You may drink water for a good 5-10 minutes. But if it's like between classes here at RCTC, you may stop at a drinking fountain, get a drink for 10-15 seconds, and then move on, and you feel satiated with the water. And it again depends on how much water you've lost, because you want to balance the output with the intake. Okay. Now, what happens with this also is this: when you have this increased osmolarity in the extracellular fluid, the other effect of that is this: is that you get a decreased amount of saliva. Okay. The saliva gets more concentrated. That creates a dry mouth. And when you have a dry mouth, that will also activate the thirst center in the hypothalamus. You drink the water to moisten the mouth. You absorb the water. From the GI tract, and then that has a negative negating effect on it. So you just don't keep drinking. Okay, all right. Now, one other thing I want to mention with this too is this, and how this works with a thirst mechanism. And remember, the thirst center is in the hypothalamus. And the other thing that causes this to happen is this: when you dehydrate, okay, you will have a decreased amount of plasma. The plasma volume will go down. Okay. Now, Josh, if you have a decreased amount of blood volume or plasma volume, right, what happens to your blood pressure? You know? It decreases, exactly. You cause a decrease in blood pressure. Okay. And if I cause a decrease in blood pressure, if you remember back from lecture earlier, talked about these juxtaglomerular cells. Oops, don't put a decrease there. The juxtaglomerular cells, these are in the kidney. And when they sense a decrease in blood pressure, they will secrete the enzyme renin. And when renin is secreted, you remember we talked about that renin-angiotensin complex. And eventually what happens is aldosterone is secreted. Okay. And when aldosterone is secreted, that will increase also the amount of angiotensin. I'm going to back up here. Renin is secreted. Let me scratch that. Angiotensin 2 is secreted in greater amounts. That will also stimulate thirst. And that's one way we can maintain our body water. Okay. And what happens is thirst is quenched pretty soon after we drink water. Even it doesn't have to be completely absorbed into the blood because you get that dry mouth feeling away. Okay. Now, a couple of things I want to mention too here. One of the other hormones that we talked about here just a little bit too is ADH. And I want to talk a little bit about ADH. All right. A little bit more just real quickly here. With ADH, okay, if we have an increased sodium concentration in the plasma, all right, what we want to do is we want to sometimes dilute that, okay? And if you have an increased sodium concentration in the plasma, what happens here is the osmoreceptors in the hypothalamus detect it, okay? They sense that it's going up. What happens then, we need to dilute the blood. So when we have an increased sodium concentration in the plasma, that means you have an increased osmolarity, okay? You've increased the osmolarity. The osmoreceptors in the hypothalamus detect it, and this causes the posterior pituitary to secrete ADH. Now remember, ADH is antidiuretic hormone. We talked about that in here. That will then, the ADH causes the collecting ducts, the CDs, the collecting ducts, to increase water reabsorption. Now, when you increase water reabsorption, what happens, Josh, what happens to urine volume? No. It's going to decrease urine volume. And what would that do then to blood volume? Do you know? Increase blood volume. Okay? All right? So that's how ADH works with that. Okay? That's how ADH would work with that. Now, I want to mention a couple things as far as with water balance and problems with water balance. Okay? And you will have these things happen periodically in your life, hopefully not very often. But let's talk about disturbances of water balance. Okay? All right. Number one is dehydration. And with dehydration, what we're going to have is obviously we've got fluid loss. And there's a variety of ways that this can happen. But, Josh, what's one thing that can cause dehydration? Okay, so severe burns. If somebody's severely burned, they lose a lot of water. What else can cause you to be dehydrated, though, Josh? Okay, but what we're doing is we're losing water, right? So if you have too much output, not enough intake, that's true. I'll put here lack of intake, because you're going to lose it daily. Sweating, right? What else causes dehydration, Josh? Do you know? Diarrhea, vomiting. Couple of things I want to mention. If we have hemorrhaging, oops, 1M, hemorrhage, and also might be caused by diabetes that's not being treated, because diabetics will have a lot of glucose that will come through and that will pull that out. Now, with a couple things I want to mention as far as signs or symptoms, because these are things to be aware of. Signs of dehydration. There are a number of signs that somebody may be becoming dehydrated. Okay, one of those is sometimes referred to as a cotton mouth, a dry mouth, where there's just not much fluid lining that. Oliguria. That means a decreased urine output. Again, our urine output should be around about 1.5 liters a day. And if that's been decreased quite a bit, that can be an example of that. If it's prolonged very long, there can be a fair amount of weight loss. People can lose 5-10 pounds in a couple days. Also, that might be accompanied by fever and confusion, just being kind of mentally not with it. And what can eventually happen if this is not corrected is it can result in what's called hypovolemic shock. If a severe enough amount of blood volume to maintain circulation. So hypovolemic shock, what happens is there's such a decrease in blood volume that there's a decrease in circulation in the body, and that can actually lead to death. So what happens here with this is we need to replenish what's lost, but that's what's referred to as dehydration. We've had that loss. So the corrective measure, of course, with this is to drink fluids. Now, if that's not possible, for example, a woman who maybe is in the midst of morning sickness and everything that comes into the mouth comes right back up, or if we have to give an IV, intravenous fluids. But we've got to get that corrected. So that's why it's so important to maintain hydration status. Okay, all right. Now, a couple things, other things I want to mention with this too. Dehydration is probably the most common disturbance of water balance. And those of you in a nursing home situation, if you're working with residents in a nursing home, you oftentimes can monitor how much they're consuming. They have a dry mouth, not urinating much. You oftentimes weigh your residents periodically to see what their weight is. And depending on obviously their mental state. Some of them, if they already have Alzheimer's and so forth, it's hard to assess if they confused or not. But it's a tough thing. So you have to do some analysis there to find out if they need more fluids or not. Now, a couple other common disturbances here. Let me get my paper organized here. And a couple of the disturbances here. A second one I want to deal with is edema. And edema is also known as swelling or edema. Okay, and this is when you have an accumulation, an excessive accumulation of fluid in the interstitial space. Okay, and that leads to the swelling. Okay, what happens with this? It can be due to a variety of things that can cause this, but one of the things that can cause this is damage to the blood vessels. If you twist an ankle, you're going to damage some of the capillaries, and the capillaries will become leaky. Okay, high blood volume. If a person's not voiding extra water and they retain it, sometimes that will back up into the tissues. Another thing that can cause this is congestive heart failure. If the heart's just not congestive heart failure, the heart's just not keeping up and can't keep pushing that blood through. Okay, and what happens with this? It's usually due. We're going to get some fluid that's going to seep out. Now, another thing I want to mention with this too is that if there is a loss of albumins. Remember the plasma proteins that help with osmotic balance in the blood. If we have too much loss of those, that can result with that. Another thing that can cause this too is when lymphatic vessels, when we have lymphatic vessels, or blood vessels for that matter, lymphatic vessels that are blocked, and or if they've been surgically removed. Oftentimes, when a person's had surgery, and let me give you a common example of this. Okay, when a woman's had a breast cancer and they decided to go ahead and do a mastectomy, they take the breast. Oftentimes they're going to take lymph nodes and lymph vessels in that area where they think the tumor is at, and then they'll send those to pathology and do some tests. Well, once they take that tissue, we don't grow back the lymphatic tissue that's missing. And then what happens is, as the fluid's coming back, we've surgically removed it, fluid then starts to leak out in that area, and there's oftentimes some swelling and edema, and that can cause tightness, can affect range of motion, and so forth. There are sleeves that can compress the tissue and help move that fluid, but there can be some issues there with that. Now, so again, edema, people don't die necessarily with edema, but usually it's a warning sign of some underlying cause that should be addressed, possibly. Now, obviously, if the lymph vessels have been surgically removed, we're not going to replace them, but we need to find out what the problem is and try to get it corrected. Okay. Now, the other thing I just want to mention is this: the last disturbance with water balance is what's referred to as hypotonic hydration. Now, remember, the term hypotonic means less concentration, and this is where you have a decreasing osmolarity. And this is usually so we've got a hypotonic solution. Remember, that means less concentrated. And usually this can be due to a variety of things. What normally happens here with this is if there is renal insufficiency, what that means is the kidneys are not voiding the excess water quickly enough. Okay, so it's almost like that you have overhydration. You've got excessive amounts of water in the body, and so what happens here? This dilutes the plasma and the interstitial fluid both, because you added more fluid to the solution. Now, one of the problems with this is that it can result in hyponatremia. Now, natremia is in reference to blood condition of sodium. So we have a low concentration of sodium in the blood. Okay, and with this can lead to some pretty bad problems. One of the things it can do is this can cause vomiting, muscle cramps, and the brain to swell, and cause lots of confusion, disorientation, and so forth. And it can eventually end in death. There have been cases where people who are like marathon runners have overly hydrated, chugged a gallon or two of water after the race, and it's been too much, and it caused them to get disoriented. There's actually been even some deaths that have been attributed to overhydration after drinking just too much water too quickly. So again, we need to consume water when we need it, and that thirst mechanism is so important, but we don't want to overdo it. Okay, overhydrating is not a healthy thing. Okay, all right, I think I'm going to stop there for today. We'll pick up with electrolyte and acid-base balance later in the week. Have a great day, and we'll see you next time. Bye-bye.